Nutrition Hero Podcast. Igniting both the art and the science of functional medicine. Here's your host, Dr. Brad Watts.
Hello, ladies and gentlemen. Welcome to the Nutrition Hero Podcast. I'm Dr. Brad Watts, as always, in the podcast lab, once again, with some special guests today. Today, you're going to be hearing a conversation that I had with Drs. Tom and Steph Chaney. They are on the East Coast in Maryland. They have a phenomenal practice, a large functional medicine practice that is impacting their community in ways that I think is pretty awesome. And so we get to talk about that today. We get to talk about some of the programming that they launch for their patients, for their community. And it's creative, a way to adapt, to pivot in this interesting year of 2020. So anyway, enjoy the conversation with Drs. Tom and Steph Chaney. I'd like to welcome to the Nutrition Hero Podcast, Drs. Tom and Stephanie Chaney. Welcome to the program. Thank you for spending a little attention with us today.
Thanks for having us.
I am excited to talk to you. I know you guys are movers and shakers, and I'm excited to see what you've been up to and what life has been like for you, maybe post-COVID life on the East Coast.
Whew.
So,
yeah,
very, very happy to get into it. But let's start here, all right, if we can.
Yeah.
Where are you right now as far as your career? Where are you in practice? What's your passion and why?
So we've been in practice since 2001, and functional medicine has been a huge component of our practice for probably the last 15 years, right? We started off as a chiropractic office, and then my upbringing and my own personal health story, which we can get into if you want.
Absolutely.
It definitely sort of dictated the path that our practice was going to take, you could say. So, and you know, some people have heard this before, and we've written about it in our books, but I had 2 autoimmune diseases through childhood, and pretty significant autoimmune diseases. When I was 9 years old, I was diagnosed with juvenile rheumatoid arthritis after a sudden onset in the middle of the night, full body attack, and not knowing really what that was, you know, we were basically told to just get with our, you know, pediatrician, and they'll monitor and they'll, you know, handle things accordingly. And it was really just kind of 3 years of sort of waiting and watching, and literally nothing happened. Thankfully, at that point, I didn't get put right on steroids, which, you know, is a common thing, but it definitely was very debilitating. I mean, I had hip pain and shoulder pain. I had, you know, the rust sign, if you remember from chiropractic school, where I literally felt like my head was going to fall off if we hit a bump in the road in the car. Yeah, I was very guarded. I couldn't chew some days because of it was in my jaw, it was in my ankles. I had been a ballerina and a competitive swimmer, and everything kind of came to a crashing halt. And it got so bad that my elbows had actually become so swollen and so inflamed that they wouldn't come out of a 90-degree bend. So you know how rheumatoid works, right? You just sort of wake up and you're in a flare somewhere else. And so that morning I woke up and I couldn't brush my teeth. I couldn't brush my hair. I couldn't come out of a 90-degree bend in both elbows. So at this time, the pediatrician said, well, maybe we should have her go see a rheumatologist. This is
right. Bright idea.
Yeah, this is 30 something years ago. So, and I also had developed psoriasis. So on top of torturous joint pain, I had torturous 24-hour-a-day itching. It's extremely traumatizing emotionally. And the solution in the rheumatologist office was, well, if this is how she is, she spoke to my mom, not to me, even though I was about 12, 13 years old. She said to my mom, if this is how she is at this point and at this stage, be prepared. She's likely going to have several joints replaced by the time she's in her mid-20s. It's a prescription for prednisone, and here's a referral for physical therapy. We'll see if we can't get her elbows loosened up and get her a little more functional. And so I remember feeling every single emotion a person could feel at that point. And we did get the prescription, we filled it. And I remember having this total, I call it my God moment, because I remember being in the kitchen and I'm holding this pill, and it is a large steroid pill.
Yeah.
Like a horse pill size pill. And I remember looking down on it, and I'm all by myself in the kitchen, and I'm very, very emotional. I'm all over the place. I'm really angry with how I was spoken to or about, by the doctor. I just felt like, wow, like this is my future. Can I get a do-over?
Right.
I'm in a lot of pain. And I remember looking at this pill, and for a split of a second, I had 100% certainty on something I knew nothing about. That's why I call it my God moment. Because I remember it was like my body was vibrating, and I was looking at this pill and I was rejecting it. So in that moment, I decided, you know what, there's got to be something we can do about this. Like, there's got to be a reason why this is happening. Like, why was the thing that was going through my head the whole time. And so we kind of had a family meeting. I did not take the pill. It was my red pill, blue pill moment, and from the Matrix. And
those have been popular this year, by the way.
Yeah, there's a lot of that going around. So I had mine 30 years ago.
Yeah.
And so anyway, so we had a kind of a family meeting, and we made the decision to leave the conventional system in that moment. Not thinking with it in that term, but let's go see what else is out there. And so we started to work with some naturopaths and chiropractors. I actually this is in Canada, I had a chiropractor who was an MD-DC, and actually thought I was going to be an MD-DC when I grew up.
Yeah. Yeah.
So my ability to get into remission, because I've been in full remission from these two autoimmune diseases for decades now. No drugs, no surgery. I still have all my own joints. I'm turning 48 this year.
Pause real quick, because you're going to rush right over it. That's a huge testament to organization and some willpower, like following through on a plan that you discovered along the way. I just wanted to say that because that's amazing.
Yeah. Well, and it was through teenage years. So I probably would have gotten into remission sooner. But it's very challenging, as many of us know, working with teenagers and young teenagers and old teenagers, getting them compliant with the things that need to be done. Plus, we know a lot more now than we knew then. So it was a bit of trial and error, with working with these different providers. But by the time I was in college, I was well on my way to being holistically healthy. And that was what got me to be a chiropractor. I went to chiropractic college already having this functional medicine experience that wasn't called functional medicine yet even. So,
right.
And I always knew that my practice would incorporate all of these things that had helped me. And I did get adjusted from high school on with this chiropractor. And I did detox protocols, and I did fasting, and I did even coffee enemas and all kinds of things to get healthy. And I just knew that for me was going to be, that was like a normal picture of what my practice was going to be.
The exciting part with this is you mentioned that 30 years ago, we didn't quite know how everything fit together from a functional perspective. Fast forward 30 years, the information's come a long way. The systems and procedures have come a long way, but guess what's still in the same spot? Modern medicine.
Oh yeah, for sure.
It's still in the same spot as it was 30 years ago. Let's just wait and see.
Yeah.
What that means is let's just hit pause on our action, but disease doesn't stop. And ultimately you're left with prednisone or methotrexate, some cancer drug to suppress the immune system now. And so it's exciting to see somebody that's lived decades with a quote unquote, lifetime of debilitating pain ahead of them. That's pretty amazing. So very cool. That, like, taking that journey from where you were into your practice. Now, both of you are partners together in practice, right?
Yep.
Right. And how does that look now, Dr. Tom, moving people down this pathway where you guys have the experience, so that your vision, right? Like you cast a vision in front of a patient and they're able to latch on to that experience. What does that look like for you guys? What kind of conditions are you serving people with at this point?
Yeah, at this point in our career, we're seeing all different types of patients. I mean, most of our patients, they come to us after they've been in conventional medicine. They've even been to other natural providers. They've been to functional medicine providers. Just sat with a gentleman this week, brought me this whole folder, I guess you could say a file, full of tests. Some of them I was very familiar with, some of them I wasn't familiar with, but he had been to all these functional doctors, naturopaths, and just wasn't seeing the results. So that's a common scenario for us. So neurodegenerative diseases, we see patients with chronic diseases like diabetes. We see autoimmune diseases. We see, we have a patient I sat with. This was before the pandemic. She came to me and she was in a little scooter. She has MS, progressive. Once again, the neurologist said there's nothing we can do. And so I said, well, I don't know if I can help you or not, but these are the things that we can do. And so she was walking in her office 2 weeks ago. She just walked in with her husband, like holding his arm. And I'm watching her walk around this person that I've never seen out of this scooter.
Yeah.
Just like amazing.
That's stunning. Like that, you hear it 1,000 times, right? In what we do, but you still get the goosebumps every time. That's amazing.
It's a lot of autoimmune. I think because it's so prevalent now. I mean, and we can argue as to why, but my onset was definitely, when we looked back on it, around the time that I had braces put on, had strep throat, and had my vaccine booster shot in 5th grade. That was 30 plus years ago. So there's just a lot of things that kind of, happened then. You look at the vaccine schedule now, you look at the toxins, you look at the environment, the epidemic of autoimmune cases. So even when people come in for neuropathy, or they come in for diabetes, or they come in for, thyroid or headaches or chronic fatigue, very often there's an underlying autoimmune component that has to be addressed. And we sort of jokingly say, we're in an area where we're right next door pretty much to Johns Hopkins, and we get all the Johns Hopkins flunkies.
That makes
and
sense.
I wish that wasn't the case. I wish they came, like, we should be first line therapy, but we're not,
Mm-hmm.
We're sort of like the last resort kind of thing.
Well,
we're so outside the box.
To comment on the reasoning to that, like in my area, it's the Mayo Clinic, right? I live in Minnesota, and so it's Mayo Clinic everywhere. And like right now, if you look with autoimmune diseases specifically, there are upwards of 80 diagnosable autoimmune conditions in 2020. 80. That's a lot. Like most doctors have never seen, outside of like the big 4 or 5, they've never seen autoimmune diseases. And the reason is they're not looking for it, right? They don't look for it. So if you're a provider listening to this wondering, well, how do these chiropractors end up finding autoimmune conditions, et cetera? It's because the paradigm is different. The glasses you put on as, somebody who's looking at diagnostics are different. We're not just looking to see what the victim is, right? And then medicate the victim. You have to go after the aggressor. And it kind of, you look at it from this perspective, and it makes sense. When you start going after the aggressor, that means you have different information, different testing, different follow through, a different plan that shows up. And I think that really is something that's going to be, I hope, I'm saying this hopefully, right? I hope this is something that in the next 10 years becomes more common. Right. The fact that you talking about an MS patient that walks into your office after, 8-9 months of care, that should be normal. It shouldn't give me goosebumps to see that. Right.
Yeah.
That should be normal.
I know. And
Man.
it's still like 20 years in practice and my own 30 plus year experience, knowing that I was able to get into remission, even though in chiropractic school, we were taught by the white coats, even in school, that,
Mhm.
these are permanent lifetime diseases. And I'm sitting there thinking, but what about what I did? You know what I mean?
Right.
Like, it didn't really make sense, but it's so, I can understand why conventional medicine will likely never get there,
Mhm.
because they have to standardize it so much for the quote unquote insurance
Mhm.
industry, that, when you determine and find, okay, this person has an autoimmune disease, you just opened up Pandora's box. Because
Right.
where the conventional system, I didn't grow up with methotrexate because that wasn't a thing 30 plus years ago. Now it's a horror show of what they throw at autoimmune patients, like
Right.
chemotherapy drugs to ruin your liver. Great.
Right.
But it's like, it's still a name that disease, and then here's the appropriate drug intervention. And it's very like, such a passive, standardized, nobody's really consciously making any true decisions. Whereas if I have a rheumatoid arthritis patient walk in, more often than not, there's multiple autoimmune diseases going on,
Right.
not just that one. And then now it's, okay, what are the triggers? What are all the 18 things that are actually causing you to be flared up?
Right.
Because there isn't one cause. And no one in conventional medicine is saying to this autoimmune neuropathy patient, okay, you're idiopathic, which means we don't know why, but no one's actually asking why. They're just slamming drugs at these people.
Exactly.
They're
And
never going to get it.
to be quite fair, a lot of people feel better while they're on the medication. In functional medicine, right, what I like to focus on are, but what about, the 8 out of 20 people that don't feel better?
Right.
What about them? Right? Those that are getting screwed over. And so that's where I like to spend my focus. And what that does is it inspires the other 12, right? That are like, hey, that person's getting better.
Yeah.
Right. With lifestyle factors, lifestyle and genetics, right? And I think that's where, again, hopefully that's where healthcare is headed here. And what you guys are doing, I think you're right on the cusp of like the leading edge of when it comes to like lifestyle science. Lifestyle science is something we've all been living, but only been studying for 30 years. And I think it's an amazing thing. One of the things that I know you guys do is you create systems and procedures in such a way that you allow people that don't have 20 years in practice of functional medicine style practice, you allow them, by educating a certain way, to reach out and help their communities. Like, really what you're doing is you're taking your experience and yourself and you're making it accessible to a lot of people. And so I want to hear about that a little bit, because this is an area that this is why I do the podcast. This is an area that I'm excited about as well. So what's that been like, Dr. Tom? What have you guys been working on outside of just practice?
Well, with COVID, yeah, we can talk about recently.
Yeah.
So yeah, when COVID hit, things changed because we do a lot of education in the public. So a lot of that was just nixed right away, and we couldn't have our educational events. We couldn't go out into the community. So we started doing a lot of online, webinars and just getting out there video and sending videos to our patients. And one of the things that we were doing is we were getting a lot of feedback from our patient base. And what they were telling us was that they were, a lot of them are feeling isolated. So they're, our age category, they weren't going out, many of them at all. And some of them were kind of getting off plan.
Right.
Stress eating.
Right.
So we actually, we had an idea, we were like, what can we do for this group? And we said, why don't we do a group reboot program virtually? So we set it up, and it was all webinar based. We did 4 weeks, and we had about 40 people on this reboot. We actually had people from all over the United States, because our patients, over the years they've moved, but they've connected.
Right.
So yeah, we got on the reboot. We started that, and it was a huge success. I mean, we saw patients that one of the patients that I was thinking of, he was a patient that we helped get his psoriasis in remission.
Mm.
And so he was having a little flare up at the time. And he was like, well, why don't I just do this reboot? And he's like, yeah, I'm totally cleared up again. So,
I like it. That's awesome.
Big success.
Yeah. So creating tools like that meet people where they are, I think that's a specialty of anybody that's good in a functional medicine space. But to be able to scale it to help 40 people at once, I think that's pretty cool. So
Yeah, it all kind of happened when I think we can all have a little moment of flashback when COVID started to happen. And when I say started to happen, at first it was limiting groups under 500, and then it turned into limiting groups under 50, and then it turned into 10 or less, and then it turned into like full-blown lockdown. That first, 500 to 50, we realized we had to basically cancel 3+ months of restaurant and hotel.
That's right.
we were doing 2 to 4 live events a week for different functional medicine niches and regenerative medicine. We're an integrated medical office as well, so we're not anti-medicine, everybody.
Right.
And but anyways, that we flipped everything to webinars. So we went completely virtual with all of that, saved our practice. Actually, really, I just look back and think, wow, we did a great job getting through COVID without a lot of bumps and scrapes. But that was around the time also that our patients were panicking.
Right.
And we didn't know what was going on. And so
the great thing about functional medicine at this time as well is we could just turn all those visits into virtual visits. So, of course, people aren't coming out for therapy. They're not coming out for rehab. They're not coming out for the regen procedures, but we can still see everyone virtually. So that's one of the great pluses with functional medicine.
But I ended up, and I think you can kind of agree with this, Brad. You and I have this sort of instinct to dig, research. We sort of dork out. and so, to empower myself will also empower my patients, right? So at the beginning of this COVID stuff, I was like, okay, we got to give people data. I needed data. What can we do to keep ourselves healthy from this mystery virus, this coronavirus thing? So before things were getting censored everywhere, we started doing a weekly live COVID pandemic protection type webinar thing. And we did that for 11 weeks straight. And those are actually posted on our website. We did not put them on YouTube because we were using, the keywords.
Right.
But we talked about all the research going back, 100+ years on different viruses and different nutrients and different things that people could get. We have an online supplement store. So we were like directing people, this is where you get stuff. I mean, places were running out of zinc. We were ordering monolaurin. It was unbelievable. And we furloughed down to like 8 staff. And so this was all going on while we were slim to none with staff. But that is it was sort of from those COVID webinars that we had so much feedback from patients saying, help. I've got, I've got relatives in nursing homes. I've gained 15 pounds. I'm depressed. I'm eating off plan. And we were also stressed and feeling like we needed to run ourselves through a detox kit.
Sure.
So that's what we did. And the way that we organized it was, Tom's super brilliant at marketing. And he pretty much, we said, this is what we're going to do. You guys have all asked for help. And we surveyed, the thousands of people that had been logging in every week. And, everyone's got their database that they can work with. And he basically said, if we were going to do a live, 4-week reboot, kind of get back on track, detox kind of program, Would you be interested?
Yeah, I was trying to get an idea of how many people are going to be interested before we put all this work time.
Right.
Yeah.
You don't want to do all the work and then just have
Put the
like your
feelers out.
mom and your aunt get ready to
So
go.
I did a survey monkey. I did 5 questions, and I surveyed how I was trying to get an idea how long would they actually engage for, how much would they pay for it. So I surveyed all these questions, and so I got a good response, and that's how I kind of evolved.
So he put it together, and he said for this 1 week, it's registration. You prepay for it.
Yeah.
Dr. Steph is going to be live 1 hour every week for the 4 weeks of the program. We're going to be doing it with you. So it really creates this amazing kind of group. We're all in this together, kind of alone together, # whatever. So we had 1 week registration. They prepaid. And we organized getting all the detox kits sent out to everybody. And we were going to start we actually got everybody paid, 40 people prepaid. And we had a start date of 3 weeks after that. We opened the registration.
Gotcha.
We just did it. We did it. It was great. It was such a great way to stay connected, but also reconnect. We had patients that we hadn't seen in 6 years. Like Tom said, that were like, you know what, I got to do this. They were chiming in the chat box, and it was so great to hear from people that we hadn't heard. It was a great reactivation tool. It turned into an amazing patient referral tool. And now we've got this sweet little 4-week turnkey pre-tape, because we recorded everything.
Oh, brilliant.
Yeah. And so now we can, all the patients that just start that maybe can't afford a full-blown functional medicine program can do this and have the weekly video support.
Right.
And we padded it. We gave them downloads of the food plan and supplements. It was just, I got into all kinds of fun stuff. But even our regenerative medicine patients, they can, you get a patient coming in with knee pain that needs a Regen Med injection, but they're 50 pounds overweight and they've got their stuff going on. Well, now you can actually build this into their program, and it's basically a turnkey thing that, it's fun to do them live, but they don't have to be all done as a group. They don't always have to be done live. And then a few weeks ago, we were on an interview with Dr. Bobby Palmer, and we were talking about this, and he said, well, what if you put this together for other people? And he kind of threw out this idea of maybe we could actually record this as a neutral thing.
Right.
And have it be something that other providers could use as a turnkey, way to get patients just on some kind of program.
See, this is where I think really the bridge in functional medicine is going to come from, right? And by bridge, I mean where you are as a functional medicine provider and where the rest of the natural healthcare world is, right? There's 20 years of learning between those spots. It's crazy town. I've been doing it for a decade. I know how crazy it is, right?
Yeah.
But that bridge of implementation is something that doesn't have to be so crazy. Okay.
Yeah.
It doesn't have to be crazy. And I think that's the cool part with what you guys are doing. Having a plug and play process that you can turn around and present to your list that you have in your clinic of patients you've seen over the last 10 years, 20 years.
Yeah.
That's an amazing way to reach people where they are, right? Without having to reinvent the whole thing over again. I think that's pretty cool.
And you know what, too, I think for like you said, functional medicine is, the more I learn, the more I realize I don't know. It's just a never-ending bottomless pit of I'm still in awe of certain educators out there that I just still aspire to be anywhere close to that. You know what I mean? Mm-hmm. And, but you're right, because it's so intimidating for someone maybe who's just kind of thinking, I want to bring some nutrition into my practice and I don't even know where to start.
Right.
We'll say this, we also have to meet patients where they are. And that's not just financially, but where are they in their ability to confront what it's going to take. It's overwhelming for patients to sometimes I'm working with a girl right now who's 16. She has rheumatoid arthritis. It's a biotoxin case. She also has babesia. I mean, it's a web of insanity. And so, I'm spending so much time just working her and her mom through the process and navigating the things that they need to do, right? As a patient, not everybody as a patient is able to be there. And as much as we individualize our programs and we individualize our testing and there are still some basic general things that everybody should do. And so you can create very simple products for patients that aren't hyper complex.
But still move the needle, though.
Yes,
where
that
they
will
need to go.
still, like, oh my gosh, maybe they just sleep better. Maybe they lose 50 pounds. Maybe their headaches go away just from cutting out soda. I mean,
That's
like,
right.
we get so complex in our functional medicine brains. Like everything is some complex, biotoxin, autoimmune, diabetes, like 20-step program. But like some people just need to start eating broccoli.
That's right. Like one of the things that I like to say to patients is they'll be like, "What's the problem?" And you got like stuff and paper, and you can create a complex narrative for them, or be something as easy, right? It can be something as easy as just saying, "Don't do that."
Yeah.
Right? Like, doctor, it hurts when I do this. Then don't do that. Right? Functional medicine doesn't have to be crazy hard. So when we talk about what you're working on with a reboot, what are some of the steps, or what is the process like for the patient? Like, what's the experience like?
Well, yeah. So what we did was, so first off, they'll go to a landing page and we put together a quick video and just kind of outline like this is what the reboot's going to be, so that they can have a little bit of understanding of what they're signing up for, and then some results so they understand that. But they're going to register, and then everything's automatic. So they get the links to all the webinars. We send out all the products, so all the products can now be drop shipped. So we kind of worked out all the kinks there. And then they log in, and we take them through that journey. And pretty much we have all the slideshows set up. And then at the end, we do a little Q&A. And so what we did was, for doctors that may be a little intimidated, because we thought, maybe this is for a chiropractor that is just doing chiropractic right now, and this might be a little intimidating. So we actually taped all of the presentations. So they could actually just push play, and they could actually just show that video week 1, week 2, week 3, week 4. So we gave them that opportunity, or they could do that for a few weeks until they get, or a few rounds until they get comfortable. And then we give them the slideshows, and then they could be the star of their show, and they could actually, host their own reboot.
Gotcha. That's cool. How many, like from a strategy perspective, what do you think people are going to do for the most part? Do you think doctors are going to allow you to walk the patients through, or do you think they're going to get excited to step in there?
I think, so I always kind of look at it from the perspective of, well, what if it was me? I would want to personalize it. We do a lot of branding for our office, so I definitely want to make it my own. So the way that we recorded me doing the actual webinar was it's not us and our practice at all. It's just it's a whole neutral kind of presentation.
Gotcha.
And so it could be, the doctor could just take the slides, the PowerPoint presentation, and listen to me doing it just to get an idea. But, here's the thing too, an experienced functional medicine doctor, they have their own way of explaining things in their own, so they can just take the presentation and follow our guide for how to set up a webinar, how to do the email blasts. They can use all that template, and they could be the star of their own webinar. So we use Webinar Jam. Webinar Jam records your presentation so that they can be sent out multiple times and posted all over the place. So once a doctor records themselves doing it live, then that's a forever thing that can then become this, send it out to any patient when they start any program anytime. And then I think there's just some people out there that don't like doing public speaking,
Right.
that aren't maybe comfortable yet with talking about nutrition and guided nutrition programs. They're just kind of getting started, but they know they got to do something for their patient base. So they could intro me doing it and then literally seamlessly have me giving the webinar. And that could be done live, or it can just be emailed out.
Or if the doctor is just so busy in their practice,
Have a staff.
their staff could actually do
That's
it.
right.
Hey, I like
mean,
that idea.
just so people understand what that means. We do diabetes reversals, one of our functional medicine advertising niches. And we used to do live seminars. We'd have a bunch of staff set it up. Then we completely transitioned to obviously virtual webinars. So we're still doing weekly. We actually do 2 a week diabetes, but it's virtual. Well, our webinars are recorded. So if I get a really good webinar captured, then we will use that to replay. And our marketing person is the person that really runs it. And it's run like a live, but I'm not actually doing it. I'm at home because it's been recorded. So my marketing person is behind the scenes controlling the keyboard kind of thing and being the tech person, but it's all set up automated now so that we don't have to always be doing it. And so the way that we kind of put this reboot program together for other providers is it could literally work however they were comfortable or wherever they were comfortable confronting.
Gotcha.
So I'm sort of introduced, and I talk in the webinar as though I'm speaking on behalf of a consultant for the practice or the consultant
Sure.
provider. You know what I mean? So I'm just me.
So this reboot program then has the presentations, it has food programming, it has the way forward for the patient, is what you're saying as well. Like it has the recommended supplementation, recommended food programs, all of that.
Yeah, what we did was we worked with one of the supplement companies that we get our kits from.
Mm-hmm.
I kind of reworked the protocols a little bit to be really, really streamlined and very easy to duplicate for both the provider and the patient. And so they get the downloadables for the entire food guide, the supplement guide. They get extra stuff too. Like if I'm talking about, how their plate should look or the schedule of their eating or, what to do. I did a whole troubleshooting week where, whenever someone's doing a detox or some type of metabolic program, for example, it's not uncommon to have bowel issues or sleep disturbance or headaches so I did a whole troubleshooting on that, and they get printouts for that type of thing. And
that's very cool.
Yeah, one week I talked about fasting and different types of fasting, including with broth or lemonade or intermittent, and so we put together downloadables. So every week there's downloadables, and these are files that the doctor obviously has access to.
Yeah. Very cool. So all right, so let's say I want to know more about this specific reboot program that you guys are launching with your patients. What do I do? Where do I find that out as a provider?
Yeah, you can check out fmformula.com/reboot. So
fmformula.com/reboot.
Yeah, fmformula.com/reboot, and that'll give a better understanding and overview of exactly what we put together.
Okay, I'll have that link in the podcast notes here for anybody listening. So, and then when you look at, patients, some of your patients are really sick. Let's just be real, right?
Yeah. Mm-hmm.
You do a reboot with them. Do you have people go through the reboot once, twice, or is this the scenario where it's like a bridge to the next step that you would then design with them?
I think it kind of went all ways that you just mentioned. So,
okay.
For example, this reactivated some previous patients that had been through intensive functional medicine programs. And this was just a way to kind of get their butt kicked back on track, right?
Yeah.
So reboot, that's kind of why we called it a reboot,
Okay.
just resetting. And then, but some people were family members or friends of previous patients that came on. And so they weren't even current patients. And so I was very careful to say, if you're a diabetic and you're on insulin, or if you've got high blood pressure and your blood pressure medications, watch out, because these things can happen. And the way that we recorded for the providers, the verbiage was, get with your provider or your prescribing doctor, just watch out. So we actually have logs for people that they can track and stuff.
Okay.
But, so you'll get that. And then the idea is, some of these people you want to then market towards, now that they're in your database, or actually, maybe you need more testing. Maybe you need, if you struggled, or maybe you feel like you need a little bit more individualized care, then we've got, these other programs. And this is where, each office is going to have their own level of what they're doing with people. So it's really up to them. They can add an extra slide. They can come in at the end and promote whatever they're doing. What I did at the end of mine was, these are the tests that we recommend for people just generally. And then we offered a consult at the end, for anyone that wasn't previously a patient. So you'll have a little bit of all of that. And then, and now we have people that just want to keep doing the reboot every once in a while, and they may just do it a week, a month on their own, or they may do it quarterly. So we also talked about those options too, as far as continuing on with things. So, if somebody's really sick, I'm going to recommend they come into my office.
Right.
The reboot is a good start. If they were successful with that, well, then now we can get into fine tuning and really supporting a person. But the way that you can promote it is they can do it anytime they want. You know what I mean? So if they go and do another round of it, then have at it.
Well, especially since everything's recorded. So that's phenomenal.
And they've got access to the replays. Once a patient's bought in, then it's just a matter of contacting the office to get another kit and doing it again. But it is funny because we've had, I have patients that are functional medicine patients, and they've been longtime wellness patients, and they got on and they did the reboot, and they're still coming in to actually just see me as wellness patients, but it was so fun for them. Now they're asking me to do a live one again for the fall. I'm like, well, you can just do it. They're like, no, we want you to do it again live.
That's what I think is so cool about functional medicine and programs that work, is it creates a culture and an experience that people are like demanding. I think that's awesome.
Yeah.
So
it's a great way to keep connected. And then I think also, you're going to have patients. We are a regenerative medicine office, so we do have patients that come in not for functional medicine, but for some type of musculoskeletal thing. We have physical therapy, and their headspace is not in a functional medicine headspace. You know what I mean? It's a different type of patient.
Yeah.
But man, could they benefit from it? And maybe it's just too much to have them do a full functional medicine program plus regenerative medicine injections and But once they have a kit and their whole reboot plan, and not only did they get injected and get their rehab, but maybe they lost 15 pounds and they're feeling better. That sometimes is a bridge for them to now cross over into the functional medicine side of a practice. But for an office that's really a structural physical medicine chiropractic office, there's no harm in doing the reboot repetitively.
Right. Absolutely. And I think that really is the easiest gateway into nutrition, is following a packaged program that has the assets you need in order to make it successful, and also in order to get patients involved. So I think that's cool.
And the way I think the way that we reworked all the supplements in our detox kit, our metabolic clearing kit, were scheduled, is we worked them so that they could be had as meal replacement shakes.
Gotcha.
As far as how we had them dosing it and what they could blend with it. And the way that I do this with patients is when I'm putting someone through a reboot or a detox program where there are meal shakes and there are capsules and there's this, that, and the other, my goal is at the end of that, when they're quote unquote done, they simply remove one of the meal shakes, replace it with an appropriate meal like they've been eating on the plan. And everything that they were doing on that reboot is something they should do for the rest of their life.
Right.
So there's no stopping. There's no, I'm done this diet and then I go back to my norm.
Right.
And so a successful reboot would just be an easy transition of just taking one of the 2 meal shakes a day out, replacing it with your second meal, and then keeping a meal shake in, mostly, most commonly for breakfast. And so now the patient, this is an easy transition for a patient into continuing to get success.
I like it. So
Long term. We always got to think long term, Brad.
Well, absolutely. But is there anything that you'd like to leave our listeners with today? I very much appreciate your attention today. I think that creating new and like different avenues into the marketplace, it never stops. And this is one that, I got excited about. 1, because it's simple. 2, it's effective. And if it's simple and effective, what in the world? That's amazing.
I know.
So anything you'd like to leave our audience with today?
Well, I think the thing that we realized after we were done is we've had so many colleagues over the years come up to us and want to bring functional medicine in, but just
can't confront it.
Yeah, it's a little intimidating. So, after we were done, we were like, this is like a great gradient step, like you said.
Yeah.
Bring this in. But in the same regard, it could be for someone that is actually a full-fledged functional medicine practice. There is just something plug and play you can add into your practice. So either way, I think it's great.
Especially if it can be staff run. I think that's the biggest benefit on the side for somebody that's already busy.
Yeah. I mean, when we started thinking about putting this together as a product for other providers to really help people, one was, this is a great virtual program, and we have to start it. You have to have virtual as part of your practice. It's never going away. Where I'm so, it's so much more profitable to not have to do 4 live actual external seminars and do them virtually now. And
yeah, not for the event centers. It's not more
I know
profitable.
I feel bad. Maybe once a month we'll have a big shindig. I don't know.
My Marriott reward points.
Yeah, that's right.
Kind of took a hit, but
Talk about a nosedive on the points.
but I think about our colleagues around the country that are solely chiropractic offices, and I can't imagine what this period of time has been like for people that are completely hands-on. Patients have to show up 3 days a week. You can't do virtual chiropractic adjustments. This is I actually feel like this is if I was just a chiropractic office, this would be such a great tool to implement, to stay connected with the people that aren't comfortable coming in yet, so that when the dust settles, they know exactly, they remember who you are because you've been constantly in some kind of connection with them. And B, the practice, gets up and running again, you're hands-on, you're at the adjusting table, but this is such an easy to implement thing that doesn't take away from your adjusting time.
Right.
Even if you did this live yourself, 1 hour a week, you could do that anytime and not have it interrupt. You're trying to rebuild your chiropractic office. And it's such an added value, because one thing we've learned over the 20 years of being in practice, and we've slowly but surely brought in different things, it was just chiropractic, and then it was nutrition, and then it was full-fledged functional medicine, and then it was regenerative medicine. And every time we brought stuff in, we have a contingency of patients that will do anything that we bring in. So a chiropractic office that has a few thousand people in a mailing database, you know, there's going to be a significant number of them because they know you and trust you, that if you bring in a little, you know, itty bitty reboot program like this, they're going to buy it.
Absolutely.
And you're going to get them even healthier than you could just adjusting them.
I'm not going to disagree with you. This is, I think that's awesome. So that's great. Doctors Chaney, Tom, and Steph, thank you for being with us here today. Go to the link in the podcast notes below and check out what they're up to. And you guys, thank you for spending the attention. This is good.
Great. Thank you.
Thanks, Brad.